First, I'll be introducing Ms. Bayan Hisham. She's a Community Outreach and Media Officer in MSF UAE, the regional office. Ms. Bayan, you can go ahead.
Hello, everyone. Thank you for hosting us. And we are pleased to be here today with you. First of all, I'm going to introduce MSF, but before that, let me share my screen. Are you able to view it?
Yes, we are able to.
Okay, perfect. So I'll start by introducing MSF. So who we are? We provide medical assistance to people affected by conflict, epidemics, disasters, or exclusion from healthcare. Our teams are made up of thousands of healthcare professionals, logistics, and administrative staff. We are founded in 1971 by a group of journalists and doctors. And this year we are celebrating our 50th anniversary. So this is one of our principles, which is impartiality. And what does this mean? It means that MSF will treat anyone who needs medical care, no matter what they are. It has a strong link to a medical ethics, seeing all people in need as equally deserving of treatment. Moving on to our second principle, which is independence. Independence means that we are aware of our political, military, and economic and religious agendas. We have our own agenda, which is to provide quality medical care for people who are in need. Neutrality means basically as quite simply, not taking sides in any armed conflict or political crisis. By staying neutral, we do not endorse one side or the other, but plan our projects based on who need our medical care or assistance. As you can see, here are few of our activities in 2019. And you can always refer to our international report by visiting our website. Here you can see MSF projects around the world in 2019 as well. We worked in 72 countries around the world, as you can see from the map. And this is our COVID-19 map. The ones that are in red are the countries that we responded into COVID-19 activities, and in the gray are the other ones. This map is from November 2020. You can always check the updated map in our website as well. Lastly, you can always stay in touch with us by visiting our social media platforms or dropping us an email or calling our office number. I just want to highlight that we opened our recent page on LinkedIn, which is MSF UAE. You can always check our latest updates, whether in the field, our news, or even any vacancy in our field. So we invite you to always stay connected with us.
Thank you, Ms. Bayan, for the actually informative introduction about MSF. And I think a lot of our audience are actually interested in your group, Doctors Without Borders. So I think moving on, we'll be going ahead to Dr. Sandrine Tiller. Dr. Sandrine, are you available?
Hello.
Hello, doctor. How are you?
I'm not a doctor, but thank you. I think it's Dr. Hassan who's next,
Okay.
actually, and then I will follow him.
Okay, so Dr. Hassan is next. Dr. Hassan Aziz.
Yes, hello. Ahmed, I don't know if you managed to receive my presentation from Bayan, because inside it there are two videos embedded, and I wanted to make sure what is the best way. I open it from here so that during the presentation I'll be streaming my videos, or maybe you can open it from your side.
I think it's the same thing because none of the audience are actually opening their cameras, so I don't think it will be much in effect. So you can go ahead, doctor.
Okay. So let me select it and share.
So a brief introduction about Dr. Ghassan. Dr. Ghassan is the Health Surveillance Program Manager for MSF's Center for Advancement of Humanitarian Medicine. He joined MSF in 2012 and has held numerous positions in the organization, based mainly in the Middle East. Prior to joining MSF, he was a trauma surgeon in Baghdad. Passionate about medical data management, Ghassan started using the HSP in 2015 to conduct large-scale community-based assessments in the Middle East and Africa using mobile data collection technologies. He has also worked on developing new facilities surveillance tools that can be used in emergency settings, such as the countries affected by conflict in the Middle East. He's also working on advanced databases for MSF, including the management of individual patient records. As a health surveillance program manager, he's also working on different outbreaks, surveillance tools, and approaches. Dr. Ghassan graduated from the College of Medicine in University of Baghdad in 2006. So, doctor, the floor is yours and you can go ahead.
Thank you so much. I think you're not receiving my screen anymore. So here I am going again and share. I just need a confirmation that my presentation is there before I go ahead.
Yes, we can see it.
Your presentation is there.
Okay, perfect. So thank you for the opportunity. And it is so nice to speak with a group of interested people to learn more about vaccines and the global health challenges that we are facing. We'll try to go through very interesting details here, and I hope that they will help you to understand better the importance of vaccines in general and what we are facing regarding the current outbreak of COVID-19. So, vaccines per se alone are probably the most significant or the most important single element that can, or second most important, that can significantly or affect or improve the quality of life and decrease the mortality among population. And indeed, it comes second after the availability of clean water for drinking. And we had a very long history before we reached to what we have so far. So the first attempt to produce something that looks like what we call it now vaccines were started in China by year 1500, when they were trying to do what's called inoculation of infected parts from people with smallpox to provide immunity against smallpox. Then there was a vaccine against smallpox that was developed by almost by year 1798. Then we heard lots of famous names of scientists who spent their lives trying to work on vaccines and trying to improve the quality of life. And surprisingly, some of the vaccines were developed or were at least first invented more than 100 years ago, like the vaccines for rabies invented by Pasteur, like the vaccine for tuberculosis, the BCG, the Bacillus calmette-guerin, that was invented in 1927 and is still in use. And later on, there were more and more technologies introduced in the development of vaccines. We make use of the advancement in the virus culture in vitro, so meaning our ability to culture or to grow the viruses at laboratory settings so that we can learn more about the viruses. And this allowed the development of many antiviral infection vaccines, like oral polio vaccine, like measles vaccine, rubella, mumps. And by the end of the last century, 10, 20 years ago, there were more development and revolution in molecular biology that helped us a lot in developing even more advanced technologies in developing vaccines and in having vaccines that can even quickly evolve to resist viruses that have multiple strains. Anyway, I will take you through small videos to give an overview about one of the main vaccine preventable diseases, our let's call it a friend for this presentation, the measles. Hope you will enjoy it. It's 3 minutes only.
Azez, the great 10th century Persian scholar, was the first to provide a detailed description of measles, which up until then had been confused with smallpox. In medieval times, measles was a scourge that struck Europe in a succession of cruel epidemics. In 1757,
Ahmed, if there is no voice in the video, please let me know. There is no audio.
Doctor, actually the voice is there, but it's a bit low.
Okay, I'll try to make sure that it's...
Sorry, doctor.
Yes.
When you share your screen, there is an option down to share the computer sound also. So if you can stop sharing, then again, share again.
Okay, I'll go for share screen, advanced sharing.
Yes, and down on the left side, you can see share sound and optimize for video clip.
Unfortunately, I cannot see that.
Oh, really?
Yeah.
Okay, I can take over, doctor, if you want.
Maybe, yeah, if you, yes.
Yes, sure.
Perfect.
Azez, the great 10th century Persian scholar was the first to provide a detailed description of measles, which up until then had been confused with smallpox. In medieval times, measles was a scourge that struck Europe in a succession of cruel epidemics. In 1757, Francis Home, a Scottish physician, used inoculation to protect himself against measles. The technique, a kind of precursor to vaccination, consisted in introducing the pathogen into a volunteer patient's body. Ancient China had already used this procedure to combat the equally devastating smallpox. But the scientific community of the time showed indifference to Home's work. In the 19th century, the measles virus was inadvertently exported from colonial Europe to previously unexposed countries, spreading like wildfire. In 1851, the disease hit the Faroe Islands near Greenland, and within 6 weeks, 4,000 of its inhabitants had contracted it. Only 5 were left unscathed. In the middle of the 20th century, there were significant advances in research in the United States. In 1954, American biologist and Nobel Prize winner John Enders succeeded in isolating the virus. Thanks to his discovery, scientists were able to culture the virus, and progress was made towards developing a vaccine. Using the Edmundston B strain of the virus, in 1963, Enders and his colleagues produced the first vaccine, Rubiovax. In 1971, Attenuvax, a combination of attenuated measles, mumps, and German measles, was the first vaccine to be injectable in one single dose. However, in 1989, scientists recognized the need for a second injection. From then on, each country introduced its own vaccination policy and vaccines. In France, the MMR vaccine, measles, mumps, and German measles, or rubella, was launched on the market in 1966. And by 1983, it was widely available to the French population. The vaccine contributed to a considerable reduction in the number of fatalities. In 1980, when vaccination was not yet widespread, measles caused 2.6 million deaths worldwide. In 2013, measles killed 147,000 people.
Okay, thank you, Mustafa. You can stop that and go to the next slide. So, after this story about the measles vaccine, you can realize that it took us more than 50 years to have a useful and usable vaccine and can be used on large scale. But during those 50 years, lots of technologies had been developed. And I personally believe that we were lucky that a disease like COVID-19 hit the humanity at this time with all this advancement in medical and technical knowledge. So our capacity for new vaccines development has been tested in 2020 with the novel coronavirus. And there are too many new technologies that were being able to be implemented from the beginning. So that imagine by 8th of April 2020, there were 73 vaccines candidates under preclinical investigation. And after almost a month, by 28th of May, there were 6 of them were already in the clinical trials. And this rapidity of response can demonstrate our ability to use the existing technologies to respond to new viruses in much faster way. We have the RNA vaccine platforms, we have the DNA vaccine platforms, recombinant vector vaccines, and many other options that can help us to develop new vaccines. Next, please. Then there are, in general, 5 stages of vaccine development that you can see them on the right of this slide, but a zoom-in picture for them are in the middle. And honestly, you will hear that a lot, and that was the reality till pre-COVID. Developing a vaccine for a new disease sometimes can take us up to 10 years, and it can cost $500 million for a pharmaceutical company or laboratory to develop a vaccine. So you need years to isolate the virus. You need an average of 2 years to have potential vaccines. Next, please. Then you have 1 or 2 more years. You have 3 stages of clinical trials where in the phase 1, you try to see if it's safe. In the phase 2, you need to see if the vaccine does activate the immune response. And in the phase 3, you check if it protects against the disease. And all those phases together can take up to 9 years. It's between 5 to 9 years. Next, please. And then to get the approvals, to have all the paperwork being reviewed and noticed by specialized committees. Sometimes this can take 1 to 2 years. So usually you might need 10 years and $500 million to get a new vaccine. Then let's go next. Let's see what's happened with the COVID-19. So for now, we have more than 7 vaccines that had been approved for use in certain countries. And all the phases of vaccine production has been literally shortened a lot because we were facing this massive outbreak. Can we go next? So in 1 year, we have managed to receive more than apparently efficient vaccines with acceptable level of efficacy and safety. After that, I think I want to take you again through something related to our beloved measles so that you can understand what I want to explain later. It's another 2 minutes video. Next, please.
In 2013, over 400 people died of measles every day. The vast majority were under 5-year-old children living in poor countries, with inadequate health systems and insufficient, poorly equipped, remote hospitals. In 2013, the Democratic Republic of Congo, Nigeria, and China were the 3 countries worst affected by the disease. Vaccination is the most effective tool to combat this highly contagious disease. In 2013, 84% of the world's children were vaccinated. This percentage is even higher in Europe, on the American continent, and in the Pacific. In Africa and Southeast Asia, however, fewer than 80% of children are immunized against measles. But there's no room for complacency. There has been a resurgence of measles in France since the end of the 2000s, and in 2011, there was a full-scale epidemic with 15,000 reported cases. This is likely due to a let-up in vaccination campaigns. Immunization rates had been steadily increasing until 2007, but they are now stagnating, or even decreasing. However, since the year 2000, worldwide, there has been an increase in vaccination campaigns, notably due to the World Health Organization's Global Vaccine Action Plan. The aim of the plan is to improve vaccination coverage in countries affected by measles. In 13 years, the number of deaths worldwide has fallen by 75%. While there has been significant progress throughout the world, coverage levels have stagnated in some African countries, and there have been several major outbreaks since 2009. War contributes to the spread of measles. In conflict situations, vaccination campaigns are suspended, health systems collapse, and civilians are forced to flee. The perfect combination for triggering all kinds of epidemics. In Syria, where measles had been all but eradicated, in less than 2 years, the civil war had caused an epidemic, and in 2011, 7,000 people contracted the disease.
So, thank you, Mustafa. Just going back to that video, what I wanted to highlight from there is that it's not enough to have an efficient vaccine, but you need to have a very effective vaccination system or program where you can maintain high degree of coverage. And once the coverage of the vaccination starts to drop, like what happens in war zones, like we saw the example of Syria, or if people for any reason stop sending or bringing their children for vaccination, you can quickly, like what we saw happening in France, you can quickly see that those infectious diseases infection rate can go up again. Actually, there's an example it has been reported for us over the past 1 month, that just because of COVID, the health services in certain countries were affected. And speaking particularly about Niger and Burkina Faso, for the past month, we start to see significant high number of measles cases, just because for 1 year, there were much less coverage of the measles vaccine. So the important point here is that vaccines are very good in providing protection and to have a significant impact on health, but it goes beyond the efficacy of the vaccine. It's about the efficient vaccination program or system in the country. Then, if we think about the impacts of vaccines, usually people think about the health impacts, but actually health, although it's a major impact of having efficient vaccine, but there are many social and economic impacts where when you think about economy, properly functioning vaccination system can be cost saving, can improve the productivity in the country, can minimize impacts on families, and can establish programs for vaccine development. And then there are links to the social justice, to the empowerment of women, to the equality in the communities. All those things are some of the impacts of the vaccine. Let's go next to speak about the health impacts of the vaccine, please. So mainly it eradicates infectious diseases. We know that, but there are more and more, because it can induce herd immunity in the community, so that you have better chances in fighting other diseases. And when the COVID, for example, start to spread, there were some studies trying to prove, and maybe this will be proven with you, that communities or people who had received BCG vaccine, the vaccine against tuberculosis, were showing less severe symptoms of COVID compared to the communities that stopped using that vaccine. Also, when you have a proper vaccination system, this can help to prevent antibiotic resistance, because you'll have less infections and less antibiotics abuse. And it can decrease the mortality and morbidity of infectious diseases. And all those are health impacts. We think that this is the simple description, but there's more. Let's go next, please. So those two figures are actually very interesting. On the left, you can see over years from 1980, when the measles vaccine was introduced, you can see the decrease in the number of cases every year with time. That was associated with the increase in the number of vaccination coverage. So the higher the coverage, the lower the rate of new cases. And this is the data from the World Health Organization regarding the entire world. It's not specific for one country. And then you can see on the right that for 14 years, from year 20 to 2014, there were more than 17 million deaths had been prevented by the measles vaccine. Let's go next, please. This is another example about, since there have been many immunization programs introduced in many countries worldwide, significant drop in the number of cases of certain diseases, diphtheria, measles, neonatal tetanus, polio, all decreased because of the proper use of the vaccines. Next, please. And this is also very nice. So this is data from United States. On the second column, you can see the maximum number of cases happened in which year for each of the diseases on the left. And then on the last two lines, you can see the percentage of disease reduction and the number of cases by year 2017. And you can see for most of the diseases, proper vaccination had reduced the number of cases between 90 and 100%. And this is a huge success for us as humanity to fight those killing diseases that used to kill millions even 56 years ago, not even far. Next, please. Then you hear terms like efficacy, effectiveness, and an impact. And here I just to highlight this, and this will be almost the last part for our presentation today, the differences between the terms when it comes to vaccines. So the vaccine efficacy is usually measured during the clinical trials, meaning that you compare the incidence of getting the disease between the vaccinated percentage of people, vaccinated number of people who were into the clinical trial, and the people who received the placebo. So just to explain a small bit here, when you do clinical trial for vaccine, you divide the number of people who participate in the clinical trial into half. Half of them will receive the test vaccine, and half of them will receive what we call it placebo. It can be anything. It can be vitamins or distilled water, anything that cannot affect the immunity from or produce immunity from the test disease. So that then you keep following those people for a certain duration of time, and to see the incidence of getting that disease among the control group which received the placebo and the real group that received the vaccine. So if you did do that on 10,000 people from both sides, you measure the efficacy by measuring the percentage of people from the study group who gets the disease compared to the number of people who get the disease among the control group. Next, please. That was efficacy. Then vaccine effectiveness, it's a whole different story. And it comes from the tracking and the follow-up of, let's say, the behavior of the vaccine in a vaccinated community. So usually it happens, or it can be measured after using that vaccine in certain community for a certain time. So it was not only important to collect data before licensing the vaccines. Now it's more important to collect data and information about the people who receive the vaccines, let's say for COVID-19 for now, and to look into the incidence rate among those people to check the real effectiveness of those vaccines. Next, please. And then to think about the impact, you can think about measuring the impact of a vaccine only health-wise. And for this, it's more simple because you can check the change in the disease outcome, or the occupancy rate in the healthcare facilities, or the proportion of people who tested positive for the disease. All these things can help us to measure the impact of the vaccine from the health perspective. But if we want to measure the real impact, the economic, the social parts, we need to run more complex analysis modules to measure the real impacts of vaccine. But for now, you can all understand it. Imagine no vaccine, lots of lockdowns, economy is going to be affected, healthcare facilities overwhelmed, people with usually treatable diseases cannot get a space to get treated, and you will lose life. People will lose money, will lose jobs because of one disease. If you have a vaccine that is effective against that disease, you can save a lot of people's lives from different perspectives. Next, please. Finally, Finally, just to come to small conclusion, vaccines can help significantly to reduce morbidities and mortalities, but actually vaccines are even more important. They are not merely health-related tools that can improve the health and quality of life. They have significant impact also on the economic and social life of people. And for this reason, it's a very noble case that we should all try always our best to have a very very efficient immunization programs, and to give a fair chance for everyone to get and to receive all the needed vaccines that can help to protect them and to protect their communities from any current or even future diseases. And I think with COVID, what's happening, it's a lesson for us, and maybe it's a bell that is ringing now for opening the eye of people and experts, not only health experts, about the importance of vaccines first, and about the importance of having efficient systems that can deliver vaccines very quickly when needed, because you can see now many countries and nations are still lagging. Even if they have vaccines, they cannot vaccinate enough people. So it's a bad experience, but it's also a learning experience for us. We will be in much better condition for the next outbreak, I hope, because it's happening anyway. Next, this is, I think, the last slide. If there's time, I can take questions, or we can go to Sandrine, and then we can go back to questions. Up to you guys. Thank you so much.
Thank you, Dr. Ghassan, for your speech. It was really interesting and informative. I think all of us actually benefited a lot from it, especially during these times that we're facing like adversities, and there's a vaccine issues that's happening with COVID. So I think we'll go to the questions after Sandrine. First of all, it's let her speak, then we'll go to the questions from the audience.
Hello, everyone. Let me just share my screen.
Okay. So just a brief introduction. Sandrine Taylor is the strategic advisor of MSF UK. And she has extensive humanitarian field experience, having worked in Venezuela, Eritrea, Tanzania, Israel, and occupied Palestinian territories, and Lebanon with grassroots organizations, the UN, the British Red Cross, and the International Committee of the Red Cross. She has been working with Medicines Sans Frontières since 2011, based in the UK office, undertaking short missions to South Sudan, DRC, Jordan, the Philippines, and Ukraine. Her expertise is in the politicization of aid and the state of the aid system. She was the focal point for MSF's engagement with the World Humanitarian Summit and is the co-author of MSF's report, Where's Everyone? Responding to Emergencies in the Most Difficult Places. She is currently working on MSF reflection analysis files, including disinformation, weaponization of information, environmental health, and the shrinking humanitarian space. So, Doctor, you can, Mrs. Sandrine, you can.
Thank you very much. So you can see the presentation? Yes?
Yes, we can.
Yeah. Great. Okay, good, because I can't see you. Okay, thank you for that. And really great to have Dr. Ghassan kind of set the scene and actually talk from the medical perspective. So yeah, I'm heading in a project that we started last year, looking at misinformation and disinformation. And we really started getting worried about it when COVID hit. And so I lead a small team, and we're really looking into how this is going to affect our project. So I'm going to give you a little overview of the issues. So I think, you know, it's clear that we're living in a new kind of information age. We call it a bit of an information disorder because we're looking, of course, at the threats. But basically, we're seeing how even in the places where MSF works, where many of which are very remote and far away, we are working in societies that are increasingly digital. These slides just kind of give you an idea of how much growth there's been in the past year in terms of use of the internet and active social media users. So we're seeing a real growth, and that's happening really everywhere. There's still certain places in central areas of Africa that aren't connected, but even in those places, there's more and more people getting online. So we're worried about the information disorder. We're very much looking, my project is so this is a photo, a doctored photo, let's say a fake photo that's been photoshopped, which is being used on social media to criticize MSF and criticize NGOs doing search and rescue operations in the Mediterranean.
Sorry,
So basically, yeah.
Your presentation is not moving. We are still on the first slide. I think you need. Okay.
Sorry. Okay, let me see if I can get it right. Here we go. Is that better?
Yes, I can see it.
Great, great. Okay, good. Okay, so this is just to show you this the kind of disinformation that we are dealing with as a humanitarian agency. So memes online, which are being used to attack humanitarian workers. And really, we've been noticing that any time that there is a kind of big issue that's being discussed online, disinformation is happening. And I think, I don't need to tell you that you're seeing that on every day. But if anytime there's a kind of any attacks or any kind of pandemics, of course, we saw it during Ebola. Now, of course, during COVID, the amount of misinformation and disinformation that's traveling around the internet is really increased. And we're seeing the rise of conspiracy theories attacking science and attacking institutions. I'm sure you all noticed how the WHO was coming under attack. And there are a lot of, let's say, armchair experts who start talking about different numbers without really having epidemiological experience. We definitely see that in the UK. So there's a lot of, science can be quite inconvenient. It can be also sometimes contradictory. Results of scientific studies, aren't always exact. Sometimes you need research changes. As we've seen with COVID, we're still trying to understand how this virus works. So this creates kind of a ground for attacks, especially from conspiracy theories, which are presenting kind of a simplified view of the world, so we talk about the information disorder, and the reason why we do that is that we see a real range of different kinds of information. So on the one side, you'll have rumors, some could be true. Then you have misinformation, something like, if you eat garlic, you will be cured of COVID. So that's like wrong information, but it doesn't mean any harm. It's harmless. But then you can have more serious health misinformation. We saw, I think, early on in the crisis, there was politicians talking about drinking bleach, or even religious figures talking about miracle cures. And then you can move to another side where you have really disinformation, which is when you're using false information to actually cause harm. And finally, we also have a term called malinformation, which is something where you use real information, like, say, my name and address, but you use it in a wrong context. So you use it to attack someone. Okay. So on the vaccination side, and that's why it's really great to follow Dr. Hassan. I wanted him to go before me, because he's given you and laid out the complexity of designing, building, and having a vaccine. And you can see that what we've seen online in particular is a real growth of anti-vaccination sentiment. And there are certain organizations, for example, the CCDH, which are really actively monitoring anti-vaccination content online, and it's really worrying. There's just a huge amount. So I'm going to I'm just going to go through a little bit where is it coming from and what's going on. But I think the main impetus for anti-vax information is financial. So on the one hand, you have the social media companies that are actually profiting from this very viral, very kind of extremist emotional content. And then you also have companies that are selling alternative cures. So they're promoting hesitancy in vaccination to actually sell you some other stuff. So those are some of the motivations of the anti-vaxxers, but it's quite an industry. You might have seen in the news actually recently that Facebook is really trying to clamp down on it. I think they're making a big effort, but it's still out there, and it really kind of is hibernating. It's lodged in Facebook groups, some of which are closed, but also in encrypted apps like WhatsApp, so people can forward false information to each other, and you know that Facebook can't really access that. So the two key areas that are driving the current discourse on vaccination are, especially around the COVID-19 vaccination, are on the one hand the political and economic motives of the actors and institutions. So you might have seen, you know, Bill Gates as a kind of hate figure, as a kind of devil figure, and of course you also have, especially in countries where there is a lack of trust in the institutions, in governments, you have a doubt that the government is on your side, because often the government isn't on your side. So people are saying, I mean, it's happening even in the UK, where there is quite a high level of trust in government, but there's still a lot of people saying, you know, we don't trust our government, we don't know what they want from us, so this vaccine, you know, we don't trust it. The other main concern around vaccines and the anti-vaccination movement is around the safety and efficacy of the vaccine. So there's a lot of concern around, I'll show you in the next slide actually. Doesn't come out very clearly here, but this green bar is, I'm worried about the side effects. So this is, you know, what people are worried about in vaccination. And I think you know, it's clear that many people have legitimate questions. You know, the development of COVID vaccines this year has been so fast. There's been a huge amount of money that's been poured into it. Many scientists have dropped whatever they were working on, have gone into it. We've also got some amazing developments in terms of technology and biotechnology, which have been used to manufacture certain vaccines. And that's meant that actually the time of developing the vaccine has been quite short. So when Dr. Hassan was talking about 2 years, 3 years, 4 years, yes, that's been the case. But with COVID, it's been a very fast development. So there are also people who are worried about that. And as you can see on the left, the list of countries is all kinds of countries. It doesn't really, it really depends on their sort of social media ecosystem. But, you know, we're seeing it a lot in the countries that have been the most affected by COVID. So here are some of the memes that you might have seen. I'm sure some of you have seen this yourself, or, you know, you've had people forward this to you. It's very interesting to see that we even have vaccine hesitancy amongst our medical colleagues. And that, for me, is very worrying. And certainly in the UK, the government here has been very concerned about that. And there's certain communities as well that happen to, have some legitimate fears. So there are a lot of people online with questions, and sometimes the anti-vaccination content really kind of gets in there to fill the void. And what's very interesting, you know, our research, having looked into this now for the past six months, has been that actually what seems to be working so well is this anecdote, you know, so people aren't necessarily relying on studies and analysis by scientists, which are proving certain facts. They'll say, yeah, those are, you know, the scientists say that, but you know, my aunt or my friend's mother had this experience, you know. So you have this kind of, I think social media really values this kind of very personal, emotional content, and that's actually working against scientific content. So what we've looked into and what we are trying to learn about as MSF is how are we going to respond to the anti-vaxxers, and certainly our digital communications teams are looking into this. So, you know, you need to have good content. If you have just boring social media content, as you all know, it doesn't go anywhere. It's really important to empathize or not ridicule people. People have genuine concerns. They're real people. They're not stupid. And, you know, it doesn't help as well if you patronize people. They'll end up resisting you. And certainly as a medical organization, we don't want to talk down to our patients and tell them they don't know what they're talking about. We have to empathize, and we have to start where they are. Yes, emotion is the currency of social media network, as I was saying before. We're trying to test out different messaging. And yes, there is a sort of fight against facts versus facts. So yeah, that may not be always the best strategy. Okay, so just a few words about what we've seen in our own operations. We have seen doubts. Here's on the right, you can see a meme that circulated in Central African Republic that makes it look basically as if MSF doesn't really know what it's doing with the vaccines and that we're experimenting on Africans, which is an old story that has been recycled, but it plays on, you know, historical truths to actually bring in a new truth. So a new falsehood rather. But yeah, we definitely have seen health misinformation and rumors affecting people's behavior. In Yemen, we had to actually really double our efforts to go and talk to the community members and really see what was going on and why they were so anxious. And this is just a little map of where we've seen misinformation flourishing, but it's definitely on the rise. Okay, that's it. I hope I didn't take up too much time.
Thank you, Sandrine. And it was very informative again. So finally, to the audience, if anyone has any questions, please go ahead and write them in the chat. Or you can talk to the doctors directly if you'd like to.
I have a question, please.
Yes, Maya, go ahead.
Okay, so concerning the percentage of anti-vaccination, the high percentages goes for the people saying that they fear of the side effects. How much it is frustrating, especially if we're considering now the pandemic. Is it considered like a bad or a negative thing? Does it reflect that like some people are more educated? Because personally I face it, and at a certain point I had this fear because no one can guarantee that we won't have long-term effects. And as you mentioned in the first presentation that usually the vaccines are under trial for years. So why should I maybe take the vaccine? Okay, I'm a future doctor, but I mean, how much it's frustrating to have such high percentages. Thank you.
Yeah, sure. I mean, the COVID vaccines have definitely, I mean, the ones, yeah, I think even the Russian one now, but most of the COVID vaccines have been through extensive trials. So I think AstraZeneca and also Pfizer have been through trials with more than 100,000 volunteers. So you can actually look up their statistics and you can see what percentage of people had the vaccine. I can say I had my vaccine, I had my first dose. And I know, I'm sure some of the colleagues from Dubai also have had their vaccine, and I didn't have any side effects. And I'm someone who is, I am on immunosuppressants, so I actually have a vulnerability. So, but I'm giving you my anecdote. But if you want to look at the statistics, it's all there, and you can see what the percentage of people had side effects. It's been incredibly low. And the side effects have been very minor, you know, things like headaches and a sore arm and that kind of thing. But maybe Dr. Ghassan, do you have any other points on that? You're the doctor.
Thank you, Sandrine. Yes, I have a small comment. So from one side, I cannot argue with what Maya just said, that indeed with this short duration, no one can predict the long-term side effects, which are usually being tested or waited for years before any drug or vaccine can be validated. But the problem is that for now we are facing a huge risk, that's COVID-19, and in majority of vaccine candidates, people, that this is what I used to tell people: any vaccine for now, for many people, any vaccine is much better than no vaccine at all. Meaning that if you are talking about someone who's a bit old or having comorbidities, having non-communicable diseases, regardless of the potential side effects or long-term side effects of the vaccines, still getting the vaccine for now is safer for him or her from the long-term side effects. This is my opinion for now. And for everyone, it's still just opinion till we have years of the vaccines in use so that we can know the long-term side effects, unfortunately.
Okay, so we have a question in the chat. It's from Mustafa. How do you propose that we as medical students can campaign for vaccination campaigns for the general public?
I think I can also take that, Mustafa, and I think this is very important. If we look at, or maybe Sandrine should take that. I was thinking about one of her figures. Sandrine, do you want to answer that? You're on mute.
Yeah. No, I would say that there's some amazing resources on the WHO website. So they have invested a lot in what they call the infodemic, in combating the infodemic. So they have some fantastic training, they have some fantastic resources, and they have all the information really kind of centralized. So brief yourselves and then feel confident to talk to your friends and your relatives about it. I think, you know, what's happened, what we've seen in Europe at least has been that there has been a lot of hesitancy, and then when the vaccines come out, people see their friends and relatives getting the vaccine, and you know, I took a selfie and I posted it on Twitter and so on, you know, just to really kind of say, look, hey, I'm doing it. We also had some of our, you know, famous actors do it, and I think the Queen in the UK, you know, has taken the vaccine. So having these kind of prominent people, influencers, you know, just wait for Rihanna to get the vaccine, and that will have a big effect. But Yeah, this is how the world works these days. Influencers have big effect. But you as medical students, I think you can really arm yourself with the scientific knowledge and then really, with empathy, kindness, gentleness, listen to people's fears, meet them where they are. There's a fantastic TED talk actually by Heidi Larson. I'll just put that. She's from the Vaccines Confidence Project. And she really talks about this empathetic response because, it's okay to have doubts. So.
Okay, so any more questions? I think the chat is disabled, so Osama, if you can work on that, the host. And in the meantime, if anyone has a question, you can open the mic and ask directly.
I'm sorry, Ahmed, I didn't hear you.
Can you enable the chat? It is disabled.
Yeah, done.
Now it's working. So anyone, yes. Okay, so Dima Abdullah has a question. She wanted to ask about the long-term effects that are still unknown. How shall we come down from this aspect? So I think what she means is that if there are people who are unsure of the long-term effect, how can we actually convince them of taking it?
So, well, I mean, Dr. Hassan might have something to say about that. So, we have already some results from the trials, and we're getting results all the time about the longer term effects of the vaccine. But yeah, I mean, I would be more worried about the long-term effects of COVID because that seems to be having a terrible, terrible effect on people, really creating a lot of new underlying illnesses. So yeah, I mean, I think that the vaccines have gone through really stringent trials, and they've been through regulations, so they're very much tested.
And I may add here, and I personally use this argument. It's not argument. This discussion with a father of one of my friends here. He was saying exactly the same. Who knows what will happen after I don't know how many years, the side effects. I told him, by any case, first of all, those vaccines were had produced following the correct scientific steps that are generally being followed to produce safe products. So in general, we have nothing that can tell us that probably they will not work as efficiently as other products had worked that they were produced a few years ago. This is one. And this might be funny, the other part I was telling him. I told him, even if it has some risks in the future, I'm sure in your life, you did many other things that were even more risky. So taking this shot is not going to be the most risky thing you ever done in your life. and you need it because it will give you protection, at least for now, from the virus until later we have a cure, we have even better vaccines. So as I was saying, any vaccine is better than no vaccine for many people.
Thank you, Dr. Ghassan. Thank you, Sandrine. I think if we don't have any more questions, we can end the session. So yes, thank you, Dr. Ghassan, and thank you, Sandrine, for your time, and thank you, Bayan, and to the whole of MSF and Dr. Without Borders for your time. And I really hope that we'll have more sessions like this in the future and more collaborations, and this is just the first stepping stone. So thank you everyone for your time, and I hope you enjoyed it, and we'll wait for you in the other sessions.
Thank you very much, Ahmad. Bye-bye.
Thank you, guys. It was a pleasure. And stay positive. Good luck for everything.
Thank you, Dr.